This conference will now be recorded.
Good evening, students. Dr. Divya from TeenEinstein. Now, can you hear?
Yes, ma'am.
Okay, what about screen? You can see the PPT, right? Yeah. So, we are in the 4th chapter now, reproductive health. So, we are learning about the positive and negative sides of reproduction, right? Or reproductive health. We are learning about that. So, in the last class, we were discussing about reproductive health. Reproductive health means what? The total well-being in all perspective or all aspects of reproduction, right? That may be physical, emotional, behavioral, and social aspects also we'll consider. So we have discussed about all these. Then in our nation, or our nation is the first in the world to initiate various action or action plans at national level also towards attaining a reproductive or a healthy society in the case of reproduction or reproductively healthy society. From our nation, we took an initiation in this. So, how to take a primary action or primary step towards this reproductive health? How can we give an initiation to a primary or a primary step or a initiation or a primary step towards reproductive health or reproductively healthy society? We can do counseling and creating awareness among people about all these reproductive organs, then adolescence, then associated changes and safe and hygienic sexual practices, then sexually transmitted infections like sexually transmitted diseases like AIDS and all. About all these things, we can create awareness, right? We can create awareness classes. We can take classes among people, those who are illiterate or illiterate people will be having very less knowledge about all these things. So we can conduct awareness classes, right? So that's how we can take an initiation towards a healthy reproductive society. So each and every one is responsible for this type of classes or awareness programs, right? Everyone can do. Those who are having knowledge or well-educated people can give such kind of classes. So by providing this medical facilities and care to that problems like menstrual irregularities, then progeny related aspects, all these things, delivery, then medical termination of progeny, so birth control, then maternal care, then all this postnatal care, all these things. These are another important aspects of reproductive and child healthcare programs, right? So about all these things, we should have awareness. So an overall improvement in this reproductive health that has taken place in our country, and this indicates, or this is indicated how we will come to know all these things are going on, like there is a reduced maternal and infant mortality. Mortality means death rate. So there is a decreased death rate, maternal and infant death rate is very less compared to earlier periods. So not only that, and cure of this sexually transmitted infections, this also, because got an improved medical treatment or medical practices are compared to earlier period, now that is far better or improved, that improved a lot. So we are getting treatment for different diseases like sexually transmitted diseases or sexually transmitted infections. So assistant, all these medical assistance and all, that is assistance making a healthier society and assist to infertile couple, sexually healthier society. So improved health facilities and better living condition. All these are promoting an explosive growth of population. Last class we learned about the population growth and what is the reason for a sudden growth in population, because we are getting improved health facilities and better living condition. So all these together works and it is promoting an explosive growth of population or an increase in the growth rate. So this population growth created a need for the contraceptive methods, because population growth, it's up to a level, it's okay. More than that means it will create problems for the food, shelter, all those things, right? So in future, if population is increasing, only the population is increasing. Our land area, that is not increasing. That is as usual. How much is there till now? That much only. But the population is increasing. So we'll face a scarcity for food and such things, right? The basic needs, for that itself we will struggle if the population is increasing this much means. So we need to control the population. So what are the methods to control this population? So there is a method for controlling this population is contraceptive methods. We need to reduce the number of children, right? So in today's now, due to this population growth, in future we are going to struggle for our basic needs. So because of all those problems, we need to find out the childbirth. So contraception is the prevention of pregnancy or the childbirth, right? So the birth control method that works in different way. You can see different methods here in the screen. You can see different methods, different types of contraception methods. So each and everything works in different way. So all Can you hear? Is it audible now? Okay, so which are the different contraceptive methods like diaphragms, cervical caps, then contraceptive sponges, condoms, all these things are coming under contraceptive methods or examples for contraceptives. So birth control, contraception means the birth control, and it is also known as birth control. It is also known as contraception, and it is designed, mainly it is designed to prevent pregnancy. Okay, main aim of the contraception is to prevent pregnancy. It will prevent the sperm and egg meeting. Okay, the fusion of egg and sperm, this will prevent. That is the aim of contraception or contraceptive methods. Okay, so birth control methods that may work in a number of ways. Okay, each and every thing here you can see so many methods or so many contraceptive methods or things which we are using for contraception. The same thing, each and everything will work in different way. So that is preventing the sperm from getting to the eggs. And the type of contraceptives include condoms, diaphragms, cervical caps, and contraceptive sponges. Okay. Then the contraceptive methods we are saying, a contraceptive should be user friendly. That should be user friendly, and it should be effective. That should be user friendly, and it should be effective, and that should be easily available. See, if it is difficult, if it is not user friendly, then common people, everyone can use that method. And if it is not effective, if you are using a contraceptive, then also the pregnancy it is happening means there is no meaning in using that, right? So it should be effective, then it should be user friendly, and it should be easily available. If it is so costly and it is not available in every places, then there is no meaning in such methods, correct? So it should be available, and it should be repeatable or reversible. Means the same method continuously people should be able to use, or it should be able to use again and again, right? Then only we can say that it is an ideal contraceptive, right? So there should not be any side effects also. It should be effective, it should be user friendly, it should be available, easily available. And the cost, then availability, then effectiveness. If it is working only 50% means there is no meaning in using such things. And it should be reversible. And there should not be any side effect. That is the main thing. If so much of side effects like any other diseases or something is coming after using this, means people won't prefer such things, right? Because people are conscious about their health also. So user friendly, easily available, effective and reversible, and with no side effect or least or minimum side effect. That also matters in the matter of a contraceptive. So an ideal contraceptive should be able to, or should be easily available, it should be user friendly, then it should be reversible, then effective, and there should not be any side effects. And the ultimate thing or the main thing is it should not affect the sexual life of a user in any way. In any way, in the case of health or the side effects, then in all way that should not affect the user, right? If it is affecting the health of a user won't prefer such things. So an ideal contraceptive should be user friendly, easily available, then effective and reversible. Then there should not be any side effect, and it should not interfere the sexual life or sexual drive or desire and sexual act of the use. So these are the qualities of an ideal contraceptive. Then different range of contraceptive methods are there. And all these methods are broadly grouped into different categories. Mainly, what is the role of a contraceptive? Because it is preventing the sperm transport to the ovum, and it is preventing the ovulation, or it may prevent the implantation of the early embryo into the uterus, right? So the role of the contraceptive is preventing sperm transport to the ovum. In the previous slide, I said what the contraceptive is doing. It is preventing the meeting of the egg and sperm. Okay, so preventing the, either it may be preventing the sperm transport to the ovum, or it may prevent the ovulation, because we have different methods. I told each and everything will work in different way. So it may prevent the ovulation also, and it may prevent the implantation of the embryo. The embryo implantation also it can prevent, so that it can avoid the pregnancy. So each embryo, implantation of the early embryo into the uterus, in that way also it can prevent the pregnancy. So mainly the contraceptive methods are broadly classified as two main groups. Okay, they are mainly classified into two groups. That means in general way, the concept of spacing, which is commonly used to space birth at longer interval, right? There should be a longer interval, or there is a long space between the birth, or the interval time between pregnancies. That should be controlled, like that should be managed. So such type of contraceptives are there. Then some like temporary or terminal or permanent methods. Such methods are also there. So there are several categories, like you can see natural methods, then barriers, then IUDs, then oral contraceptives, then injectables, then implants and surgical methods. So these are the main contraceptive methods. Okay, wide range of contraceptive methods are available now, and they can be broadly grouped into the categories. Like first one is natural and traditional, natural or traditional method, then barrier, IUDs, oral contraceptives, then injectables, then implants and surgical methods. So these are the different types of or different categories of contraceptives. So we need to learn about each type. So mainly, what is the role of a contraceptive? It is preventing the sperm transport to the ovum, or it is preventing the ovulation, or sometimes it may prevent the implantation of the early embryo into the uterus. All this depends upon which method we are using, or which type of contraceptive we are using. So depending upon that, it may prevent the sperm transport to the ovum, or it may prevent the ovulation, or it may prevent the implantation of the early embryo into the uterus. So many contraceptive methods are broadly classified, and they are natural method, barrier method, then IUDs, oral contraceptives, then injectables, implants and surgical methods. So there are different methods. So the first, among that, the first method is the natural method. Okay, first method is the natural method. See, in the natural method, that avoids the sperm and ovum mate, interaction of the sperm and ovum. Okay, first method is the natural method. In this natural method, that is avoiding the sperm and ovum meeting of the sperm and ovum. That is avoided in the case of natural methods. Okay, that sperm and ovum interaction is not there in this. It is preventing natural methods. They're trying to prevent the ovum and sperm meet or interaction, and ultimately that is avoiding the fertilization of the ovum. What is the ultimate aim? It is avoiding the fertilization of the ovum. So this can be achieved by different methods. Okay, so different methods, this sperm and ovum meeting can be avoided. Okay, first method is among the natural method, the first method is periodic abstinence. Okay, periodic abstinence, or otherwise it is called as rhythm method. Okay, periodic abstinence or rhythm method. This is nothing but the temporary avoidance of sex. It is the periodic abstinence means it is just avoiding the sex for a temporary period. Okay, so in this what the couples can do, a couple can use the knowledge of the physical change that occurs in the female reproductive cycle. So couple, they can utilize the knowledge of physiological change, the physiology in human body or in a female body, the physiological changes that is occurring in the female reproductive system. In the reproductive system of a female, what and all physiological changes are happening. Based on that, a couple can do this. Okay, a couple can work out on this. So they can decide based on the reproductive cycle. So based on that, to decide whether to abstain from the intercourse on those days when pregnancy is likely to result. Okay, so if there is a chance of pregnancy during that period, it's better. Such method, periodic abstinence method, what they will do, the couple will avoid the intercourse, or they will decide based on the physiological changes in the female reproductive system. They will decide whether to abstain from the intercourse on those days or not. Okay, so that is the thing which is coming under periodic abstinence. Okay. So it's a physiologically, this method is developed based on the female reproductive cycle, physiological changes occurring in the female reproductive system. So during 1930s, this is developed. So it is called as a rhythm method. It's based on the rhythm of the female reproductive system, right? So there is a basic rhythm in the female reproductive cycle. So based on that, this method is developed during 1930s. So it is also called as rhythm method. Note down, it is also called as rhythm method. Periodic abstinence method, it is otherwise called as rhythm method. This is nothing but based on the female physiological changes that occurring in the female reproductive cycle. Based on that, the couple can decide whether to abstain from the intercourse on those days or not. So that involves, like, during those days, the sexual intercourse on those days when ovulation is likely to occur. See, there is here you can see this menstrual cycle wheel. In this cycle, the follicular phase, this is the growth period. Then ovulation period is there. Then luteal phase. All these three phases are included in menstrual cycle, right? So the follicular phase, the maturation of ovum, and then ovulation. Ovum is releasing. That period is called as ovulation. And after that, luteal phase, right? So the days before the cycle and just few days before the cycle and after the cycle, like just 3 days before and after the cycle, the couple abstain from coitus. Okay, so an average woman's cycle, you know that it is around 28 days. Then the ovulation occurs around 14th day of menstruation, right? When that ovulation occurs, 14th day of menstruation. And the ovum, that ovum will be alive for 1 or 2 days, and the sperm can survive about 3 days, right? That sperm can survive around 72 hours. That means 3 days. So pregnancy can be avoided if the couple doesn't have any intercourse on those days. So this is the method, or periodic abstinence method. In this method, during the ovulation or just before 2-3 days before ovulation and after ovulation, during that period, if the couple they doesn't have intercourse on those days, this method will be successful. But the effectiveness of this rhythm, that depends. Okay, because in all women or the females, the cycle, the period of this menstruation cycle, it won't be 28 days. So we can't calculate that period. Like this ovulation period, it won't be around, it varies. Like it may lead, it is around average we are saying it is around 28 days, right? So it may extend up to 35 days also, 32 to 35 days. So the effectiveness of this rhythm method of birth control, it's not very high, it's very poor. Effectiveness is very poor because in many women, the irregularities, you can see the irregularities in menstrual cycles. So this method is not so effective. This is just a natural method, one among the natural methods, but this is not so effective. Okay, this is not an effective method of birth control. So in this method, this is just the temporary avoidance of sex, and this is the way in which a couple can use the physiological knowledge of the reproductive system, female reproductive system. We can check the physiological changes that is happening in a female reproductive system, and based on that we can decide whether to abstain from the intercourse on those days or not. So 3 days, just 3 days before the cycle and 3 days after the cycle, that couple should take care, or the couple should abstain from the coitus, right? This means a woman's menstruation cycle, and on an average it is around 28 days. So the ovulation period, it is around 14th day of menstruation, and that ovum may remain for 1 or 2 days. So if the couple they are not having intercourse during these days, that pregnancy can be avoided, right? But just now I said this method is not so effective because of the irregularities in the menstrual cycle of most of the women. Okay, but the chances of fertilization, it is very high during this period, and it is called as fertile period. The chances of fertilization during which period? During that ovulation period, just before 3 days and after 3 days, I said during that period the chances of ovulation is very high. So that's why we are saying this method is not so effective. Okay, so this is the one method in which couples avoid to abstain from coitus from day 10 to 17, like 3 days before and 3 days after ovulation of menstrual cycle, when ovulation could be expected. So during this period, during that ovulation period and before and after those days, the chances of fertilization, it is very high during that period. So it is called as fertile period. That period is called as fertile period because fertilization chances are more during that period. Okay. Next natural method is withdrawal or coitus interrupts. withdrawal are called as intrus. In this method, that male partner or male withdraws the penis from the vagina just before ejaculation, or just the time of ejaculation, that penis will be withdrawn by the male partner. This is to avoid the insemination, so that semen is carried outside the vagina. If the semen is not inside the vagina, or it is not entering inside vagina, there is no chance of pregnancy, right? So that penis from the vagina should be taken out, or just before ejaculation it should be taken out, and this is to avoid the insemination. So the semen is carried outside the vagina. So this method, it is moderately effective. Why it is moderately effective? Because ejaculation, just before ejaculation, that male, while studying about the male reproductive system, we learned about all these things, semen and ejaculation, all those things. So this method is not so effective. Why we are saying like that? Before ejaculation, male passes a pre-ejaculation fluid, right? A pre-ejaculation fluid is passed just before ejaculation. So this also may contain sperms that may also cause fertilization, right? So that may also create a situation for fertilization. So even though male ejaculates outside vagina, this pre-ejaculatory fluid, or that fluid may also, there is a chance of presence of sperm in that pre-ejaculation fluid also. So there is a chance of fertilization. So we can't say that this method is so much effective. In this natural method, this method is also less effective, because this is the method in which the male partner withdraws his penis from the vagina just before ejaculation. So that part they can avoid the insemination. But this is not so much effective method, because just before ejaculation, the male partner or the male that may pass a pre-ejaculation fluid. This pre-ejaculation fluid that also contains some sperm. There is a chance of containing sperms, which may also cause fertilization. So even though the male ejaculates outside the vagina, from this pre-ejaculatory fluid, from there also there is a chance of fertilization. Got it? Next is, in natural methods, next one is lactation amenorrhea. Lactational amenorrhea. That is the next method in natural methods. So in this, the absence of menstruation method, that is the importance of this method. Absence of menstruation method. So this is based on there is no menstruation cycle in the body of a female, and there is no ovulation. So based on that, this method works. Okay. When this occurs during the intense, or the more the lactation occurs, or during the childbirth, there is a lactation period, right? So during that period, there won't be any menstrual cycle in the female body during the parturition and lactation period. In that period, there won't be any menstrual cycle or this cyclic process in the female body. So based on that, the absence of that menstruation period, this method works. Okay. So in the absence of menstruation method, it is based on the fact that ovulation and therefore the cycle do not occur during the period of intense lactation following parturition. So after parturition, there will be a lactation period or intense lactation period, because that during that time the child will be taking only this, or the child will be getting nutrition from the breastfeeding, only from the breastfeeding, right? So that time there won't be any menstruation cycle in the female body. You can see here that baby suckling stimulates the nipple. Okay, from that, the nipple stimulation that triggers the signal to mother's brain. Okay, then this signals disrupt hormone production, and disruption of hormone that suppresses ovulation. Okay, that's the way this method, lactational amenorrhea, works. So there, as long as the mother breastfeeds the child fully, the chances of conception, it's almost nil. So during this period, there won't be any ovulation. So the chances are nil. Chances of conception, it is nil. And during this lactation amenorrhea, this is effective only up to a period of 6 months. Maximum up to 6 months it will work. Okay. And in this method, there is no medicine, and that's why there is no side effects. So during this is the period during which there is no menstruation cycle. So during lactation period, maximum up to 6 months, we will get this. So up to 6 months, there won't be any menstruation cycle, because that female body, it is coming back to the normal female body after the pregnancy and parturition. It should come back to the normal female body process. So after 6 months, minimum it will take 6 months to get back to the menstrual cycle and such things after delivery. So during that period, there won't be any ovulation, there won't be any menstrual cycle during this lactation period. Because during breastfeeding period, there will be some kind of hormonal changes because of the feeding. So that time, there is no usage of medicine. No medicine we are using for this absence of this menstruation cycle. So it will work without any side effect. We are not using any medicine, and there is no side effects also. But this method, effectiveness is very low, because after 6 months, at any time, that menstruation period or menstruation cycle may start. So the chances of failure, that is also high in this method. The chances of failure is also high. Okay. Next is barrier method. Next method is barrier method. Now natural methods got over. Next is barrier method. Barrier method means in this ovum and sperm, they both are physically prevented from meeting and interacting. How it is prevented? Due to the presence of mainly physical barriers which prevent fertilization. Physical barriers are preventing the meeting and fertilization. So there are different methods available for both male and female. Okay, in this both male and female methods are available. So in barrier method, ovum and sperm, they both are prevented from physical meeting with the help of barriers. Barriers means we are creating some obstacles between the meeting. Okay, right? We are not allowing them, that sperm and egg, to meet, because without meeting there is no fertilization. So to prevent fertilization, there is a prevention of meeting or interaction of the egg and sperm. So in this method, the ovum and the sperm both are physically prevented. There is a physical prevention for the from the meeting of the egg and sperm, and there is no interaction. This interaction and meeting both are physically prevented. Okay, with the help of barriers. And these methods are available for both male and female. So in barrier method, first we are going to discuss about condoms. Okay. Condoms mean they are the barrier made of thin rubber or latex sheet, and these are used to cover the penis in male and vagina and cervix in the female. Okay, in both male and female condoms are available, but in it is made up of this. This is a barrier method. The condom, it is a barrier method of which is made up of a thin rubber or latex sheet, and these are used to cover the penis in the male and the vagina and cervix. Both parts are covered in the female. You can see here. In male, penis is covered with the condom, and in female, the vagina and the cervix both are covered in the female. This is female condom and this is male. So just before coitus, this can be used just before coitus, so that that ejaculated semen that will be collected in the condom and it will not enter into the female reproductive part. Okay, so this can prevent the conception. Okay, so male condom means it's non-porous. It's non-porous. There won't be any pores, and it is made up of latex or rubber, thin rubber or latex, and it is covering this is covering the penis in male, and this prevents the deposition of sperm in female reproductive tract, because when the ejaculation occurs, the sperm is entering to the female reproductive tract. So that is prevented with the help of this condom. So Nirod, you can see Nirod, it is a popular brand of condom for the male condom. Nirod is a popular brand of condom for the male. And a female condom. Next is about a female condom. You can see here a female condom that is called a vaginal pouch or femidom. It is mainly designed to prevent the sperm from reaching the uterus. Okay, this is also designed to prevent the sperm. The sperm won't enter the uterus. It is preventing like that. So it is composed of two flexible rings that is connected by this sheet. You can see here also one ring and here also one ring. These two rings, it is connected by a flexible sheet. And this diaphragm, this female condom, this is also preventing the sperm which is entering to the uterus. Okay, so condoms, they are the barriers made of thin rubber or latex sheet that is used to cover the penis in the male and vagina or cervix in the female. So just before that intercourse or coitus, so that ejaculated semen that will not enter into the female reproductive tract. Okay, that sperm should not enter into the female reproductive tract, and this can prevent the conception. Okay, this can prevent the fertilization or conception. And Nirod is a popular brand of condom for the male. Okay, this is the male condom brand which is released by government. And next, the use of condom. This has increased in recent years due to its additional benefit of protecting the user from contracting STI. What is STI? Sexually transmitted infections and AIDS. See, the use of condoms that can prevent the sexually transmitted disease as well as AIDS. Sexually transmitted disease means what? From one person, it will transfer to next person, right? So, if you are using this, through sexual contact, it will go to next person, right? So, if you are using condoms or such barrier methods, this will prevent the entering of sperm into the vagina or the uterus. So that along with that prevention of pregnancy, that will protect from the sexually transmitted disease and diseases like AIDS. What is AIDS? Acquired immunodeficiency syndrome. AIDS means acquired immunodeficiency syndrome. That is also transmitted through sexual contact. Okay, so both the male and female condoms are disposable. Both are disposable condoms. This male condom and female condom, both are disposable, and that can be self-inserted and thereby gives privacy to the users. This both normal people they can be used these condoms and all without the help of medical practitioners, right? So this can be self-inserted, and that's why we are saying contraceptive should be user-friendly. So here it is a user-friendly method, right? So they can be inserted without anyone's help, self-insertion, and it is disposable. Next, in barrier methods, the other methods are diaphragms, cervical caps, and walls. So these diaphragms, cervical caps, and walls, these are also barrier methods. Okay, and these are also made up of rubber, and that can be inserted into the female reproductive tract to cover the cervix during coitus. Okay, this diaphragm, cervical cap, and walls, this can be inserted into female reproductive tract. Note down this and all for female reproductive tract. In the case of condom, for both male and female, it is available. But this diaphragm, cervical cap, and walls can be inserted to the female reproductive tract. This is to cover the cervix during coitus. It is just to cover the cervix during coitus. Note down MCQ, important MCQ, just to cover the which part this can be used. You can get a question like diaphragm, cervical cap, and walls. These are just to cover the cervix during coitus and can be used only in female reproductive tract. And this prevents the conception. How it will prevent? By blocking the entry of sperm to the cervix. This won't allow, if this cervical caps or walls or diaphragms are used, then there won't be any entry of sperm to the cervix. Okay, and these are reusable. So that is another plus point of this contraceptive. They are reusable. Okay, but in the case of condom, they are disposable. Here these are reusable. And spermicidal creams, jellies, and foams, these are used along with these barriers. This is why it is used. It is used to increase the contraceptive efficiency, to increase the efficiency of contraceptive. Okay. Next, here you can see the diaphragm, then cervical cap. Here, see how cervical cap is used. It is preventing, it is blocking the entry of sperm. Okay. Then walls. All these are used in females. Next is intrauterine devices. Okay, here you can see intrauterine devices, IUDs, intrauterine devices. This is another method. These are called as intrauterine devices. These are inserted by doctors or expert nurses. And where it is inserted into the uterus. Through vagina, it is inserted to the uterus. So without the help of medical experts, you can't do this method. So these are the devices which are inserted by doctors or medical experts to uterus, female reproductive system. This is inserted. So it is inserted to the uterus through vagina. So intrauterine devices are nowadays it is available, commonly available. And copper releasing IUDs, non-medicated IUDs like Lippes loop, non-medicated IUDs. Example, Lippes loop. Note down. This and all coming under intrauterine devices. It is inserted in the uterus through vagina with the help of medical experts. So these intrauterine devices are available in many forms like non-medicated intrauterine devices. For that, example is Lippes loop. Then copper releasing IUDs, copper releasing intrauterine devices, because that prevents the sperm. Then hormone releasing IUDs, all these things prevent the fertilization. Just to prevent the fertilization, these intrauterine devices and are used. Just that is preventing the entry of sperm into the uterus. So this intrauterine devices that increases the phagocytosis of sperms within the uterus. Okay, the copper ions. Why this copper? Here I said this copper releasing IUDs. Why it is used? This copper ions will release during this intercourse. So this copper ions that will suppress the sperm mobility. That intrauterine devices, which is copper releasing ions. If they are using copper releasing ions, the copper ions are released. So these copper ions will suppress the sperm mobility. Mobility of the sperm, it is suppressed by this copper ions, and that will reduce the capacity, the movement of the sperm, so that it cannot reach the uterus. And next, the hormone releasing IUDs. This makes the uterus, which is not suitable for the implantation. Okay, for the implantation of the zygote or embryo, that uterus condition should be proper, right? It should be in a proper condition or situation to release the embryo. So the hormone releasing IUDs will make the situation very bad. That means that the condition of the uterus will won't be suitable for the implantation of the sperms or the embryo, or after fertilization, that situation won't be good. Okay, or it won't be suitable for the implantation. Next, intrauterine devices are, they are the ideal contraceptive for the female who want to delay the pregnancy. This IUDs are the ideal or good method, contraceptive method for ladies or females. They want to delay the pregnancy period, or there should be a gap between the first and second pregnancy and all. So this is the most widely accepted method for contraception in India. In India, this is most widely accepted method. Then contraceptive pills. This oral intake of this contraceptive pills, that may be either progestogen or progestogen-estrogen combination. Both methods are used by the females. These are used in the form of tablets. So both these compounds, like progestogen alone or progestogen-estrogen combination, all these are used by females, used in the form of tablets. They are used in the form of tablets. And these pills we need to take daily for a period of 21 days, starting from the first 5 days of menstrual cycle. Soon after completion of 5 days of the menstrual cycle, these pills can be used. And for another 21 days. For another 21 days continuously, this should be used. Okay. Then after a 7 days gap, that 7 days gap means during that period menstruation occurs. Okay. So after that gap, it can be repeated. In the same way, we can repeat that until and unless they want the conception. Okay. So up to that, these pills regularly, these contraceptive pills can be used. How this contraceptive pills works? They inhibits the ovulation and implantation. Ovulation and implantation, and they will prevent the entry of sperm also. Okay. And the pills are very effective. They have they have side effects, but in minute level, or very less side effects they have. And females are accepting these methods mainly. Then an oral contraceptive for female, that is having a very less side effect, that is Saheli, and once a week pill. That is a once a week pill. This is having very less side effect and it is having very high contraceptive value also. Okay. Then injectables. These are another method like progestogen or progestogen in combination with estrogen. This is also used by females as injections under the skin. Okay, injections or implants under the skin. And in this method, it is working in similar way, like how that pills can be used in the same effective way. This is also working. This also makes the periods as much as longer, or the gap between periods it's making, or it's delaying periods. So progestogen or progestogen estrogen combination, or this IUDs within 72 hours. 72 hours of coitus or within 3 days. This is found to be very effective in preventing this pregnancy. Okay. So, in the case of rape or unprotected intercourse and all, this method is found to be very effective. So, progestogen along with estrogen, this combination you should note down. That is an important MCQ. Then surgical methods. Surgical methods. This is also called as sterilization. So this is used by both male and female partners because this is the terminal method to prevent any more pregnancies. This is the method to prevent the pregnancy. So both male and female can use this. So surgical invention. In this, what they are doing, they block the gamete transport, and that's how they are preventing the conception, blocking the gamete transport of gamete, male gamete transport as well as female gamete transport. So this procedure in male, it is called as vasectomy, and in female, tubectomy. In male, it is called as vasectomy, and in female, tubectomy. Vasectomy and tubectomy. Okay. So in vasectomy, a small part of the vas deferens, it is removed. Here you can see. From testis, all the sperms are getting produced, right? So in this, in vasectomy, a small part, this is called vas deferens. You can see here. This is the vas deferens, and this small part of the vas deferens is removed or tied up through a small incision on the scrotum. Okay. Here you can see the vas deferens. It is tied by making a small incision on the scrotum. So there is no connection. So that the passage is blocked. Passage of sperm, it is blocked. Okay. But in the case of tubectomy, in tubectomy, the small part of the fallopian tube, here you can see the fallopian tube, small part of fallopian tube, that is removed or it is tied, and this is how a small incision in the abdomen will be made, and through that all this fallopian tube will be tied and cut. Okay, and this method is effective. This is highly effective, but the main problem is their reversibility. We can't make it proper whenever we want. See, when we are using the contraceptive method like pills and all, whenever we are stopping, body will come back to the original form, like the menstrual cycle will continue, right? But here we are cutting and we are making a disconnection between. Here in the vasectomy, you can see here, this is tied. So the passage is blocked. Passage of sperm is blocked. Here also in tubectomy also, the fallopian tube is cut and tied. So that the passage is blocked, passage of ovum. So to make it in the earlier form, it is very difficult, or the chances are very less. Okay. So the selection of a suitable contraceptive method and the use, that should be always with the help of medical professionals, and they should always remember that the contraceptive, these contraceptive methods, they are the we doesn't need that as a regular requirement because it is for the maintenance of reproductive health. So they are practiced against the natural reproduction or the natural reproductive event. So it is against the conception or pregnancy, right? So these methods we should use only to prevent pregnancy or to delay, or there should be a space between pregnancy due to personal reason. Only that time this should be used. Okay, this we should not practice it as a permanent method. Okay, and the widespread use of these methods, they have significant role in the checking of uncontrolled growth of population. So use of these methods have significant role in checking uncontrolled growth of population. Okay. So selection, during the selection also we should take the help of medical professionals, and this is not a regular requirement, just for the maintenance of a reproductive health. So we should remember that this is against natural reproductive event, or it is against the conception, natural conception. So when they are using that, it is to prevent the pregnancy or for a delayed pregnancy, that time only. Okay, to create a space between the pregnancy due to so many personal reasons. So only during that time this kind of method should be used. Okay, and use of these methods have significant role in the checking of uncontrolled growth of population. Okay, got it? So that's all about contraceptive methods. So do you have any doubt? Anyone is having any doubt?
No, ma'am.
Okay. So go through these things, this chapter, and we'll continue in the next class, the remaining portion. So if you have any doubt, ask me in the next class. Thank you. Thank you so much.
Thank you.